Hey everyone, this is Amanda Moore from the Angelman Syndrome Foundation, and you're listening to the ASF podcast, the show that explains everything you want to know about Angelman syndrome. We're so excited you're here, and we hope you enjoy the show. Well, thank you so much for joining us here at the Angelman podcast, and welcome to season 3. We're so excited to hear from someone really remarkable and amazing within the gene therapy community today. I'm going to jump right in because we have so many questions we want to ask, and you know we always get questions at the organization about gene therapy and our community understanding gene therapies and who's out there supporting this. And I'm incredibly excited to have on our podcast today Congressman Erik Paulsen. And he's the chairman of the Institute of Gene Therapy. And recently, the Angelman Syndrome Foundation, along with the Foundation for Angelman Syndrome Therapeutics, joined their advocacy council. And the first meeting I went to, I was just so inspired and was so excited to hear about all the people in the space and all the work that's happening. So give a big round of applause to our friend, Congressman Erik Paulsen. Welcome to our podcast.
Oh, it is great to be with you, Amanda. Excited to have a conversation with you today. Thanks for having me.
Absolutely. I think it's really important because when I got online and was learning about your institute, I immediately read your bio, and what an amazing life you have lived so far, and the work that you have done has been really inspiring. Can you just give us a little background on just yourself? I'd love to know more about you.
Sure. And, basically I'm in Minnesota. So I represented Minnesota's 3rd Congressional District for 10 years in Congress, which was a great honor.
Wow.
I had a chance to serve in the state legislature. My background's a little different because I was a mathematics major before I decided to kind of
really
out of public service and government. But I will say this is that during my tenure in public office, particularly in Congress, I did a lot of focus on the med tech community, which has a big constituency in Minnesota, for instance, and was a strong voice for that community because of the innovation that it brought to improve lives, to save lives. And that led into my more education exposure to the rare disease community, other life sciences. And so after I left Congress, it was like, hey, there's an opportunity here to continue my policy work in this field by starting up the Institute for Gene Therapies with some other folks. And so now we can talk a little bit more about what IGT, we call it, is doing now. But that's kind of how we got launched into this process.
It's amazing. A lot of our families that are listening right now are from Minnesota. We have a lot of individuals living with Angelman syndrome that are from the Minnesota area. So I'm sure that they are listening and exciting to hear from you. We've had really great support from representatives in that area. So thank you for all the work that you have done. So, a lot of people who are listening right now, probably maybe the only time they ever heard of the Institute for Gene Therapy is when we announced that we were a part of the advocacy group. So can you just share maybe a little bit about the mission and the goals of the Institute?
Yeah, absolutely. IGT, we were created 5 years ago. We started up, and it really has been an exciting 5 years during this tenure because we've seen lots of new gene therapy approvals by the FDA. We've seen new policy initiatives advance during our time as an organization. So our mission is essentially this. We're working to make sure that the healthcare system and the policies around it are keeping up with the science, especially with gene therapy, the new frontier of medicine. So we want to maximize the potential of gene therapies by modernizing the regulatory and reimbursement framework so that patients are actually able to realize the promise of gene therapies, because this is an important new frontier of medicine. And to do this, and you mentioned, how kind of the Angelman Syndrome Foundation came to be a part of us, but we've brought together expert stakeholders from across our healthcare system. We have patient advocacy organizations. We have the manufacturers, of course. We have individual patient experts, researchers, scientists. And we all know that at the heart of our mission are really the patients, which is why we have the Patient Advocacy Advisory Council. It's so important. It's so critical. We're delighted, of course, that Angelman Syndrome Foundation is a part of that council in just the last year. And it's certainly helped further strengthen our collaborative efforts. So I guess it comes down to making sure that we're ensuring patient access to gene therapies. We're advocating for our policy leaders and our key decision makers to make sure that we can modernize the reimbursement system. We want to make sure we're preserving the FDA's accelerated approval pathways, looking at newborn screening access, supporting innovation. So that's just a little bit kind of a part of our mission, kind of our goals as we look forward.
Well, what I love about, that was a lot, right? So, that's a really lofty goal, the goals and objectives, but such an important role that has to be played. The one thing that we've been doing within the Angelman community is a lot of advocacy work recently, because we know that in order to get any sort of treatment across the line, or in order to preserve the benefits that our loved ones need to really thrive and have a quality of life, advocacy is so important. But what I've realized by joining groups like this is that you will get so much further when you join a collective voice instead of trying to really climb that mountain on your own, right? And so that's what I really loved about joining the Institute for Gene Therapies, is that you do have a really unique, diverse group of people sitting together, looking at the challenges, looking at the areas of opportunity, and figuring out how we tackle and how we move forward to get access. And that is right around kind of our sweet spot in our organization, of that's what we love and what we like to work with. I'm curious, because that's a lot, and there's a lot going on right now when it comes to, with any new leadership, you're going to have changes. But I'm curious, from your perspective, where you sit right now and who you work with, what are some of the biggest regulatory and policy challenges that gene therapy is currently facing?
Yeah, and there certainly are some hurdles. The very nature of gene therapies gives us challenges, from our traditional regulatory paradigms that we have, because these are treatments that are relatively new. They're relatively unique, obviously. They're the potential for one-time treatments that can offer long-lasting benefits for the patients and also the healthcare system at the same time. So it's about rethinking our policy and our regulatory landscape. So our current reimbursement system, just as an example, is not set up to accommodate an influx of new gene therapies that are going through the FDA approval process. And this is really important to make sure that patients have access. There are threats out there for the FDA's accelerated approval pathway and the coverage of those treatments as we move through that process. It's really critical for the development of gene therapies. But if you just take a step back, I think one of the biggest priorities and hurdles that we face in general is just making sure that our policymakers in Congress, our regulators, and even the general public have a good understanding about how incredibly unique the value of gene therapies are. Because, we're spending 85 cents of every healthcare dollar today managing the symptoms of chronic illnesses and chronic diseases over a patient's lifetime. And, gene therapies are giving us an opportunity now to disrupt that, to change that. And sure, they might be expensive up front, but there are also huge potentials when you've got cures and durable treatments that can last a lifetime and actually save the healthcare system money over the long time. So that's really exciting innovation now that can give patients and their families new hope, but also help save the healthcare system more in I guess in the long term. So at IGT, we're working with our decision makers that are out there, helping them understand the unique value of these therapies. It's not just about the money, but it's improving lives. And we don't think one size fits all value assessments work, especially for rare diseases. You talked about the collaboration, for instance, of Angelman's Syndrome Foundation working with other organizations. But, when you have 6,000 plus rare diseases and all those different rare disease communities, when they're coming together as a collaborative effort, it certainly does help offer more flexibility and looking at the bigger picture about how these therapies can help patients, families, the healthcare system as a whole.
What I loved about what you said, the quote that you gave about 85 cents per the dollar for the healthcare, that speaks very loudly to us as a community, because, there is this fear that anything that comes down the pipeline that could be a possible treatment for our loved one with Angelman will be incredibly expensive. So access is something we're fearful of. But I love the way that you put it in the perspective, kind of the unique perspective that you flip it on, is that we just did a kind of an economic burden survey for our community as well to figure out what is the dollar amount of the economic burden per year on a loved one with Angelman. And it came out to be a very large number. And so it's one of those things where you look at, yeah, up front, getting access may be a challenge. The dollar might be high, but long term, this is a win for the healthcare, the healthcare issue. And so I do think, I love that you guys, that's kind of something that you're focusing on, because it's one thing that we really worry about. If we are able to get a drug passed into the finish line, what happens as far as access? Because our goal is that anyone who has Angelman syndrome that wants treatment will be able to get treatment. And it seems to be a lot more challenging and cumbersome to get for that. Like, it's not as easy as it seems sometimes, right? So it's nice to know that there's institutes out there that are kind of looking at that, because I do think it's a hurdle that a lot of rare disease groups will face to get access to these drugs.
Yeah, and as an example, there's another patient coalition that I was just with recently, the Hemophilia B coalition, and another example of a very expensive treatment process for these patients. But they've got opportunities with new therapies that are online now to take away a lot of those treatments, right? Over the long care of the patient on a lifetime, you can save the healthcare system a lot of money and then really improve these patients' lives over time.
Absolutely. Hey guys, it's Amanda here. As you know, we're here for you, our community. If you have questions about any topics we can discuss in our podcast, or if you have ideas for future episodes, we'd love to hear from you. All you need to do is email me at dearamanda@angelman.org. Thank you so much for listening and your continued support of the Angelman Syndrome Foundation. Well, we just had our PFDD meeting last week, our first PFDD meeting, and a lot of what came across and the feedback from the families was, any sort of clinically small, even a small clinically meaningful change would mean a huge amount to our families and to our communities, and how it translates back to the overall, health of the family, of the caregiver. Like it's kind of like it's not just treating the actual individual with Angelman syndrome, you're impacting the whole family unit. So it'll be interesting to see how it plays out once we get close to that treatment. But it's nice to know that we have institutes that are really fighting for this. So I'm curious, how does the Institute for Gene Therapy really, kind of collaborate with patient advocacy groups, with researchers and policymakers when it comes to, these advancements?
Yeah, we all know and recognize that it takes all of us to help shape these healthcare policies that are out there. And again, ensure that all patients are at the center of everything we do, which is why our advisory councils that we have represent the manufacturer side, the corporate side. We have the patient component, which you're a part of. And then we have the scientific, academic, and medical perspectives also that kind of ensures all this comprehensive input, if you will. So we convene all these different advisory groups. We have 3 of them in total, corporate, patient, and then scientific, academic, medical. We convene them on a regular basis, quarterly, if not more often, to share key policy updates, to gain patient perspectives, to help convene roundtable discussions. We have Hill briefings on Capitol Hill and a lot of other things. And so by fostering that collaboration, we're really hoping that we can lead to more important conversations, ensuring that patients have more opportunities to thrive as a part of that process.
Yeah, so I'm curious if, a lot of, my rare disease leaders in the space may be listening to this. I mean, is would it be helpful to have multiple rare disease communities as a part of that advocacy? The larger your advocacy council is, kind of the stronger. Like, do you encourage as many people as possible to reach out and get engaged with your institute at any time?
Yeah, we really do. And as an example, I know that a lot of rare patient organizations, they have their own individual fly-in days on Capitol Hill, for instance, when they meet with their members of Congress. So sometimes there may be policy initiatives and legislation that we're supporting as a group, and it helps to have our rare disease communities all on the same page, advocating for 1 or 2 policies. It helps build more momentum to pass some of these initiatives in Congress.
100%. I agree with you. Like I love when we go to do Every Life and there's so many people kind of fighting for the exact same thing. Right. And I know we just had our fly-in the 1st of March, and I've never seen Capitol Hill, the building, so busy. there are so many people coming at this point and really working to advocate for their cause. And so I do think it's really important to have that voice. I mean, speaking of that, you talked a little bit about the policies and us coming to help with, really advocating for the policies you're shaping. What role does the Institute play in shaping policies and, around affordability and access for gene therapies?
Well, as you and your listeners or your members know, I mean, any delay in access to gene therapies can also lead to irreversible damage, for patients, right, in terms of their own health. So we're focused on a couple of key solutions that are going to help ensure more timely access. And so, one, we've got value-based payment arrangements, these VBPs, we'll call them. They're really important now in a modern reimbursement system because it gives more flexibility for the manufacturers and for the payers and the providers. We have legislation called the Medicaid VBPs for Patients Act, or the MVP Act, we call it. So it will now be reintroduced this Congress. It would help create a pathway for state Medicaid programs to voluntarily enter in these new value-based purchasing arrangements with the drug manufacturers. So it's going to help drive improved patient outcomes through personalized evidence-based treatments. And that's really important. We also believe that CMS, as the government, they should be issuing some guidance and ensuring that states are covering these FDA-approved gene therapies once they go through that approval process, and cover them right away and immediately. And that's all aligned with the approved label. We're advocating for mechanisms now to facilitate payment over time arrangements, because if they're expensive, we can break it out over time and you can pay based on results. If the drug isn't working for some reason, then there can be refunds set up as a part of that process. And so that's been part of the legislation and part of the rulemaking process, bipartisanly, I should mention, that we've seen through the first Trump administration, into Biden, and now into the second Trump administration. So we're going to continue to build off of all those policies. I'll also just mention another joint legislative initiative called the Accelerating Kids Access to Care Act. That has been reintroduced this Congress, and that would be expanding, getting rid of more red tape for patients that do have to travel, for treatments, for instance. And then we're also exploring some other innovative insurance models and payment mechanisms to help address some of the challenges, like small insurance pools and, the financial shocks of single-time payments. So in the end, it's about, I guess it's balancing incentives for innovation while ensuring that there's some equitable and affordable access for these treatments.
That means the world to our community. I mean, I love the fact that it seems like you all are being very creative with your policies but that would benefit the patient. I mean, the idea of having to pay a one-time astronomical cost for a treatment does terrify me as a parent. Like I would do anything for Jackson, but if it's way out of my price range and just can't even manage it, that's heartbreaking for a family to see that there's something out there that could be beneficial for our kiddos, but not actually be able to have access to it. So sign us up however we can help push your policies. We will be there as much as we can. I mean, you've shared a lot already about the things that you're working on, but for kind of thinking the next 5 to 10 years, I'm curious, what are going to be your priorities in making gene therapies more available to those who need them? Because the hope is that we are going to see kind of an explosion in gene therapy in the next 5 to 10 years, and there's going to be a lot more opportunity than there has been before. So what is going to be your institute's priority around that?
Yeah, no, it's a really good point. I mean, as we look out 5 to 10 years, we've been around 5 years, but a lot of our, plans are building off of what we've done. So we're going to continue to focus on ensuring patients have access to gene therapy. So if the FDA is approving 5 to 10 of these new treatments per year, and there's going to be more and more approved per year as these are all in the pipeline, we need to make sure we're pushing for that modernized payment system so that gene therapies are covered and they're paid for. Again, protecting that accelerated approval pathway is really, really important because, for a lot of patients, this is sort of the only opportunity for treatment initially. And you can build on clinical outcomes over time, for those patients, for instance. And so we want to have a regulatory environment that's going to be supporting clinical translation of all gene therapies. So I'm excited for your members and your listeners being a part of that advocacy process and making sure that access to these new treatments of gene therapies are going to provide a larger story for how we can accelerate the value of therapies, as you mentioned, for the caregiver, for the family, and everything that goes into that value component for these treatments. Absolutely.
I mean, I will tell you, from a parent perspective, when I heard about this institute, I had no clue that it even existed, right? I mean, it's hard to live outside of the diagnosis, the daily ups and downs that we have when it comes to having a child with any sort of diverse need. But to know that there's these, specific institutes out there really advocating, it feels like it takes a little bit of pressure off us as caregivers, because we feel like we wake up every single day ready for battle to advocate in some ways. And so I really, really appreciate all the work that the Institute's doing. I'm going to put you on the spot. And if there are any of my friends listening in who are running any sort of rare disease organizations or organizations that are looking into gene therapy and want to learn more about the Institute and want to maybe get engaged, what's the best way for them to go about that?
Well, we really encourage folks to visit our website, which is gene-therapies.org. And so we've got one-page policy papers there. We've got policy papers on newborn screening, all the other legislative initiatives that we chatted about. We're very active in various social media channels. We appreciate the engagement. We want to amplify the work that you're doing at the foundation. Mm-hmm. And then we look forward to having you continue to participate in our quarterly meetings and getting feedback, and then participating or working with you on Capitol Hill for briefings or your fly-ins, because in the end, again, it is about the patients. So, there are a lot of large organizations on Capitol Hill that work in the life science space. We know of the pharmas and the bios, but they're very big, and we're more nimble and focused on gene therapies, and we're the first organization to just have that sole focus. And so we think we're there at the right time, focusing on the right initiatives to help a very important rare disease patient community.
I agree. I mean, I my first call I attended, the one thing that's really hard sometimes being in this space is, especially now with everything that is going on the Hill, there's a lot of information being thrown in so many different ways, right? There's just so much going on. And what I appreciated about the call was you have people who are really boots on the ground, understanding what is happening, keeping up with the different legislation, keeping up with the different bills, and having people come and try to explain it in ways that make sense to myself as someone who maybe not have an expertise of being in politics, right? But has a real big passion on serving our community and making sure they get access to the things that, that they deserve for their child and loved ones. So I would encourage anyone who's listening, any of my friends, to definitely reach out, look at the website. It's a great website. It does have some really great one-pagers on the policies. It gives some great updates, but even better, being a part of any sort of consortium or any sort of group where you get to come together with people who are walking your same walk, it really makes the burden feel less heavy. So I appreciate all that you guys are doing at the Institute for Gene Therapy. I appreciate your time today. I know you're incredibly busy. But you have a large community behind you in the Angelman community. We are a very active and a very engaged community, so we will support you in any way that we can. But keep up the good work, and thank you for all that you do for those living with rare diseases.
Well, thank you, and we look forward to our continued collaboration, and encourage your members and listeners, of course, to reach out anytime. We look forward to continuing that engagement.
Absolutely. And so for all my families that are listening as well, make sure you go and like their their Facebook page, and they do post some really great updates on things that are going on. If you just want to keep up with what's going on in the space, they have a fantastic social pages. So make sure you check that out, and we'll make sure to put it in the link. So thank you so much, Congressman. It's been wonderful to talk with you, and we look forward to having you back on the show sometime.
Sounds good. Have a great day.
You too. Thanks for listening to the ASF podcast. If you enjoyed this episode and would like to support us, please share it with others, post about it on social media, or leave a rating or review. And please don't forget to subscribe.